Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Chief Public Health Official and Director for the Division of Public Health and Community Services. And I'm joined today by Heidi Peek, who is our Health Officer for our Environmental Health Department and for the City of Nashua. We're going to talk about World Rabies Day and all things that pertain to rabies and what our Environmental Health Department does with our community as far as providing education and awareness, and also promoting the rabies vaccine for our pets who are a part of our family. So Heidi, tell us a little bit about your department, about yourself, and why is it important for our community to know about World Rabies Day and what they can do to protect their pets and their animals from rabies and also from any other things that can cause situations in their homes with their pets with regards to contact with wild animals and rabies.
Certainly. My name is Heidi Peek, as Bobbie said. I've worked for the division for almost 30 years. We have a small department of 6 people, and we do a lot of general environmental health things like inspecting food service, inspecting pools and spas, and responding to complaints. One of the more serious duties that we have, though, is in the role of the local authority for rabies. We are the local, we, meaning me, and the animal control officer are the local rabies authority. So we make decisions about whether or not an exposure has happened, what happens with the animal, and ensuring that the public is safe. And rabies is very important to be aware of because it is probably 99.9% fatal if you contract the disease.
Right.
There's a period of time where someone can receive what's called PEP, post-exposure prophy, but that window is small and it has some things that it's dependent upon. So we try to make sure that people know what their risk is and know how to take care of themselves and their loved ones, to include their pets. And as Bobbie said, it is World Rabies Day on the 28th of this month, and we are excited to let people know how to take care of themselves and just the importance of what can happen with exposure to this virus.
So Heidi, let's talk about some situations of exposure, right?
Sure.
Because sometimes people may not know that innocent raccoon or possum that just happens to be wobbling around in the yard where it's not supposed to be during the daytime, and they just want to go and help the animal out. Can we talk a little bit about that type of exposure, and then also a bite, an animal bite?
Certainly. Let's start off with the domestic animals. It's best if somebody has exposure to an unknown dog, cat, or wild animal, they should report that to the Nashua Police Department as soon as possible so that we can figure out if the animal has been vaccinated appropriately, if it's a domestic animal, or if somebody needs to seek treatment for a valid exposure to a wild animal. We want to make sure that our own pets are vaccinated so that if they're out indoors and outdoors, they don't come into contact with a wild animal. And exposure is not bloodborne with rabies. Exposure would be a bite or a scratch and the introduction of saliva or any of the central nervous tissue into that open wound on somebody's skin. So if somebody has an instance where they have come into contact with, well, their animals come into contact with like a raccoon or a skunk, we ask them if they wore gloves to deal with the saliva on the animal's coat, because that is one of the ways it gets into the body.
Right, yeah. And it may seem benign, initially,
Right.
correct? And so people may not be paying quite attention to that type of exposure. But again, that saliva that could be infected with, the rabies is what we're concerned about as far as human exposure. And can we talk a little bit about, you mentioned the vaccine. Why is that so important to pets, for pet owners to make sure that their, animals are vaccinated?
Absolutely. We make decisions based on the outcome of animals depending upon whether or not they are currently vaccinated. And what can happen is that typically a dog that's not been vaccinated but is owned goes into quarantine at the Humane Society. An unknown cat that has bitten a human is typically euthanized and then is tested for the presence of rabies, and then decisions are made after that.
Yeah.
And a lot of the contact that the public has with wild animals will result in euthanasia of that animal because the risk is so high. We do have, every once in a while within the state, a positive rabies. We haven't had one in Nashua for quite some time, but we're very watchful, and we know that animals can travel a distance, and we've had a lot of bats in homes this year too.
Right.
So we try to give people the best information that they can to make as informed a decision as they can. But sometimes the decision that we have to make is not the one that any of us would prefer.
Want to make, exactly. Yeah. So let's talk a little bit about, some more animal exposure, because right now, during this time period, it's where I call this fall already. So September 1st started fall. But, there are going to be people that are going to be out hiking. There are people that are visiting national parks where they
Sure.
could be exposed to wild animals. So it may not just be, in Nashua. We're still in a rural state. So it could be, outside of, the inner city, or maybe even in the inner city, since we see
Sure.
so many things actually coming into the inner city as well. But, we've got folks that travel, they're hiking, they're in the woods. So that exposure, what should people do to avoid exposure to a wild animal that typically is not supposed to be out during the daytime?
You want to keep those wild animals at a distance, and if someone who is less able than an adult person, you want to keep children or anybody who is frail protected and away from that animal. You also want to make sure that your pets aren't free roaming so they can just come into animals, because you don't know what exposure may have happened.
Right.
If you have a dog that's been in some sort of a fight and you can't identify what it is, the dog needs to be seen by the vet to figure out whether or not it needs a rabies booster.
Right.
But
and that again is why those vaccines are so important, right? Because if that dog
Absolutely.
wasn't vaccinated, is a booster going to help?
If it wasn't vaccinated, it needs to be in quarantine for a period of time to see if it develops symptoms of rabies.
Yeah. And what did we say? 99.9% is
Yes.
a fatality.
Yes.
With our pets, animals, and even with humans. I don't believe that there has been a case of a human with rabies that actually survived. I think there was one.
There is one, and I can't remember the method that they used specifically, but it was almost as if, I know it was an induced coma, but it was the same treatment that they use for deep sea divers, I believe. She came out of it.
Right.
They've tried it on other people, and it has not worked.
Right. So we're talking about a really serious
Absolutely.
Threat to public health. Even though the cases may not be as numerous, which we don't want, we still want folks to be aware of the possibility. Now let's talk about our flying friends, the bats.
Okay, I thought you were going to talk about travel. Yes.
Oh no, the bats,
The
right?
bats.
So because right now, as the dusk of fall comes on, we are going to be seeing and are already seeing bats around. And so, what does our listening audience need to know about bats when they find them in their homes?
That has some subtleties to it. One of which is that if you wake up and find a bat, If somebody is unable to communicate well, or it's a child or a pet, if you wake up and find a bat, that is considered an exposure, a potential exposure to rabies.
Right.
Not that the bat is definitely carrying the virus, but we still need to make sure and make the best decision for the human. So it's important for people to be mindful of keeping their doors open, their windows open. We know that a lot of people will like have a grill on the back patio or something, and then they're turning the meat over and they run in, they leave the door open, or the dog's coming in a few minutes. But that's enough time for a bat, especially if it's like dusk-ish or early in the morning where they may be moving around a little bit. It's important at those times to keep the doors and windows closed and be very mindful of that.
Yeah. And I tell you, it can be a pretty interesting event. We actually had a bat in our home. We'd come back from vacation and the bat was in our home, and so guess what we were greeted by? And that we went from room to room trying to stay away from this bat, and at that point in time we opened every window we could to make sure that the bat had a way of getting out. But we were awake and we were aware, so there was no butterfly kisses, you know, from the bat, and that's the thing that we want people to be aware of. If you're sleeping or a child is in a room sleeping, you know, the bat could possibly land, you know, on that human, and that's when they don't know what type of exposure could have occurred.
Right, because their teeth are so tiny that you may not feel it.
Yeah.
Even if you are, you'd feel the being right next to you, but you wouldn't necessarily know that it had bitten you.
Right.
It wouldn't wake you up.
And then what else do folks need to know about if they do find out that they woke up and there was a bat in their home? What should they do or try to do with that bat?
If they hold on to it until we can talk through a scenario of exposure. And so if I would advise people to go ahead and call the non-emergency number at the police department to notify the animal control officer, or you could call environmental health, and we will talk somebody through it to ask the questions to see whether or not any potential exposure has occurred. And at that point, what we would want is the bat to be brought to us, or we go pick up the bat, because then we'll put it into our fridge, and then we will take it up to the state public health lab for testing.
And that's basically the only way that you can test for rabies in an animal, is that it has to be tested at a state lab. So it's not a blood test, but there actually has to be you actually have to have the animal
and the brain tissue
and whole.
Yes.
Right. And so if someone does have a bat in their home that they wake up in the morning, if they can capture it safely and without damaging the head, that's going to be the best way to actually analyze whether or not that bat has rabies.
Yes.
And what about other animals? Same thing?
Fish and game tends to deal with a lot of the wildlife. They will, if there is an animal that has had close contact with a human, to include a bite or a scratch or some sort of broken skin with the introduction of saliva, Fish and Game will typically capture the animal and then euthanize it and then send it up to the state for testing. Sometimes they don't have the capacity to drive it up, so we will do that, and they work very closely with the animal control officer as well.
Yeah, and Nashua is very fortunate that we actually have an animal control officer, and you and he are usually quite busy at different times throughout, especially this this fall. But the thing that we really want to drive home for those of you that are watching us today on Public Health Matters is to make sure that you get your dog vaccinated, because the expense of the quarantine can really be an issue for some families. And then just the fact that, you know, some of those animals are pets then have to be euthanized if there's no way of telling about their exposure.
It's heartbreaking.
It is heartbreaking.
And it's hard to make that decision, but we know that we have to for the sake of the human beings who are exposed.
Right.
I was going to touch on something else. You had talked about traveling. It's very different in the world. Rabies globally is much more serious in the continents of Africa and Asia, and the fatality rate is fairly high, and it's largely because of the wild dog populations that they have. So there are a lot of efforts to try and get wild dogs vaccinated, certainly neutered as well, and to keep especially children out of the path of some of them, because a lot of the fatalities are in children, and it really is tragic what happens. And so we want to make sure that anyone who is traveling in a country and there are animals in the area, don't come into contact with them. Don't pat any animals that you don't know are vaccinated or not.
Right.
You could still do that in Nashua as well.
Yeah.
Don't come
It's very interesting that you say that. We had the opportunity to do some traveling this year and went to Kenya, which is in East Africa, as well as to have the opportunity to go to Japan. And what I did notice was that there weren't a lot of stray animals out at all. So they are taking some efforts to keep that population down. But we do know that there's bats in those areas, and so the idea is to be educated and be aware of the potential dangers of exposure to bats and exposure to wild animals. And in particular, again, there's some animals that they're nocturnal, that we don't normally see in the daytime. And if we do see those animals during the daytime, you just want to make sure, teach your kids to stay away from those animals. Don't go near them, don't pet them, don't pick them up.
Right.
And can you share a couple of different incidences that the department has had to work through with regards to a couple of exposures? Because we've had some of late. No positive rabies cases in people, but we have had some people that were exposed to wild animals trying to do very helpful things.
Right. We had a couple of years ago, we had a person who saw a raccoon that was hit and it was still alive. So he wanted to do what he thought was the right thing with the animal. And he put it in his car, and he had somebody else in his car with him, and then he tried to get help for the raccoon, and he was met with Fish and Game instead, who said that they had to euthanize the animal because both people had come into contact with it, and it turned out to be rabid. They were both Massachusetts residents, so they ended up dealing with Massachusetts Public Health Department in assuring that they were treated for that exposure. They were not happy when they realized that their contact with the animal ended up with the animal being euthanized.
Right.
So it's
just as we said, that's the only way that we're able to actually test.
right.
And in that situation, it was protocol and it was the right thing to do so that they could find out about their own exposure to get the prophylaxis that they needed.
Correct.
Right? And that prophylaxis does require some injections, a set of 2 injections.
Much less than it used to be.
Yes. Oh, yes. Still in the same spot, though? They are still Oh, they're in the arm now?
Yes.
Oh, well, that's better.
Much better.
That
yes.
is much better. Yeah. So, but it is down to 2 now.
I believe it is.
Yeah. In any case, it's something that has to be treated. You have to take the prophylaxis to prevent, any development of rabies, in humans. So, Heidi, talk about some other things that we're doing over in environmental health with regards to reducing animal exposure. So we work very closely with the animal control officer. we do expect for folks to call if they've had some exposures. What are some other things that you would recommend that folks in the community do with regards to their pets? You talked about keeping them on leashes. What else can folks do to protect them?
Current vaccinations, that is really, that is probably the most critical piece, and having them, ensuring that they're healthy. I know vet costs have gone up considerably, but prior to this, I did look up some options for vaccination clinics. Humane Society is probably the best bet. I know that PetSmart and Petco have little vet clinics from time to time. Tractor Supply does as well. So there are some fairly low-cost clinics for vaccinations. And they do a variety of vaccinations as well.
Yeah.
You want your pet to be as healthy as possible, because then they can bounce back from something a little bit more easily.
And then the city, we offer our free rabies clinic. When is that? In the month of April?
There have been some changes to that. What has happened now is that they, at the Humane Society, take a look at their page, and they're expanding their facility right now, so they're kind of in a state of change. But you can go there for low-cost vaccines as well.
Yeah. And so we actually have a relationship with the Humane Society as well. So the city does contract the Humane Society for protection of animals, cats, dogs,
And ferrets.
Rabbits, chickens, rabbits. Yeah. So we have a good relationship with our Humane Society. And so if you do have exposure, you do want to make sure that you do what first? You want to call who first?
You want to call the Nashua Police Department, and that gets the paperwork going so that we know what we're dealing with. Every bite, there is I've forgotten what they call it, but there is a report made so that it can be referenced in the future if something happens. And that, then we send a form in response to every bite to make sure that a vaccinated animal was then seen by a licensed veterinarian to make sure that the animal is healthy. If it's not vaccinated, it's going to be quarantined, and people very often will have the option of paying for a quarantine. That's not cheap, though.
Right.
Or the animal goes to the Humane Society. If it is a cat with no owner and there's significant exposure, that cat is euthanized.
Yeah. And then the containment period is about 40 days?
It depends on, it's typically 10 days within that first time. If
Is that if they're vaccinated? That's
Yes.
vaccinated or unvaccinated?
it's 10 days for that post-bite exposure, because the smaller bodies, the virus is going to move more quickly in their body, so they're going to show symptoms sooner.
Wow. Yeah. So yeah, it's a serious matter. So we want our pets to be vaccinated. There are options available at the Humane Society. Also, your vet can also supply vaccinations for rabies. And this is an annual. No, rabies is, trying to think,
It's first of all, when they're young, they get it for the first time when it's safe. And then I think it's over 6 months of age.
Yeah.
And then you get on like a 3-year cycle.
I think it's 3. Yeah, I was about to say, because I think it's either a 2 or 3 year cycle for the pets. But we do want to make sure that our pet owners are aware of that, and they keep their animals' vaccinations up to date with other vaccinations as well. So rabies is just one. And then there's other vaccines that the dogs will get as well. Distemper, they get the, believe it or not, whooping cough, but it's not called whooping cough. It's not called pertussis, the Bordetella.
Yes.
Yeah, they get that.
Yes.
But that's exactly what that is in humans. It's whooping cough, as well as some other vaccines. And so, but we really wanted to highlight the importance of World Rabies Day and help our viewers understand the importance of getting your pets vaccinated to protect them against any exposure, and then also to reduce any human exposure to ourselves and your family and your friends by getting that education that's needed and the awareness. Because we know that bats will be in the homes. Not everybody's home will get a bat, but for those that bats actually do come into the homes, you need to be aware of how you need to take care of the bat. If you can catch it, save it so that it can be tested. You definitely have to try not to do any damage to the bat's head.
Yes.
So they can get that brain tissue to test to make sure that they weren't
right.
And rabid.
It's a good idea to have a pest control company come in to see how they're getting in and how best to treat them to keep them out.
Yeah. And don't hang out where they hang out.
No, no. And it's also important to vaccinate indoor-only cats because they can escape and they can run into a wild animal if they are out in the wild by themselves. And then if that exposure to a human happens, it doesn't have a good outcome for that cat.
Right. What about some other pets that folks may have? What about ferrets and all of the other little furry things?
Ferrets are also in the RSA, what's commonly called the Rabies Control Act, because of their popularity and because they're technically not a rodent. Rodents tend to not give rabies. They're small and it moves very quickly through them.
Okay.
But people can ask questions about that with ask their physician if they come into exposure with any animal or if it's an unknown animal.
All right, Heidi. Thank you so much for being here with us to
you.
talk about World Rabies Day. What is the last thing that you want our viewers to know before we sign off?
It's back to the vaccinations.
Back to the vaccinations.
Yes.
Just like in humans, these vaccinations are really important for saving lives.
They're critical.
Thank you.
Thank you.
Well, thanks for being here. I'm Bobbie Bagley reminding you to have a great day today and a better day tomorrow. And I'll see you the next time on Public Health Matters.